This segment sponsored by GBMC Healthcare.
It's a disease that may affect some of us or our loved ones later in life, Alzheimer.
Today, Dr. Oluwatosin Thompson with GBMC Health Partners is giving us the lowdown on signs, symptoms, and prevention of this disease. Thank you so much for joining us.
Good to be here.
Very important conversation.
Yes.
So let's start with what it actually is. What is Alzheimer's disease?
Alzheimer's disease is a condition that causes death of neurons due to abnormal buildup of proteins in the brain.
Interesting.
Yeah.
So then what is the difference between that and dementia?
Yes, so Alzheimer causes a spectrum of disease. On the mild end, we call that mild cognitive impairment, where people may have difficulty with memory. And then at the very severe end, which usually develops over years, people may have difficulty accomplishing tasks needed for independent living, such as bathing, dressing, and feeding. This stage we call dementia.
Gotcha.
Alzheimer is the most common cause of dementia.
So let's get into the symptoms, doctor.
Yes. Yeah, so at the very early stage, people may find increased difficulty with more recent things, what we call short-term memory difficulties, and they may find themselves, repeating themselves more often, or asking, having their loved ones repeat themselves to them more often, and then they may have difficulty with, navigating space and things like that, difficulty with multitasking at the very early on, and then later on may have more difficulty with bathing, dressing, feeding, and so on.
Interesting.
Is there anything that we can do to lower the risk factors?
Yeah, so reducing our cardiovascular risk factors is important. So taking care of oneself, treating high blood pressure, diabetes, high cholesterol, very important. Of course, maintaining social interaction and keeping the mind active is all very important too. And reducing the risk for traumatic brain injury too is very important, and reducing one's risk for Alzheimer's disease.
Sure. So say we already have a diagnosis, can we slow the symptoms down? Is there treatment available?
Yes, so there really is no treatment as we speak for Alzheimer's disease, but there are things that has been shown to slow down the progression. What we do find the most powerful thing, of course, is keeping one's mind active. So social connections, keeping the mind sharp can be very beneficial too. Some medications out there too, and has been shown to reduce the decline in progression of Alzheimer's.
That's good to know.
Yeah.
And do you have any advice for caregivers dealing with loved ones who have Alzheimer's disease?
Yeah, just saying there's help out there, and feeling comfortable enough to speak to your loved one's healthcare provider that, hey, I'm having a hard time, I need help. Asking for help can sometimes open up doors that might sort of reduce that burden, and that they have in care for that loved one, that time and financial burden. Lots of help out there.
And how do we even start that conversation with a loved one if we're noticing these signs and symptoms?
Yes, so that can be very difficult. I think just starting out from a loving standpoint, say, hey, I've noticed this and that. Would you be willing to come and just talk to a doctor about this? I think that's a very good way to start the condition, because they may or may not have the condition, but the first step is, of course, bringing them to a physician and talking about things.
Having that open flow of communication.
Exactly, it's very important. Yeah.
And what age on average do we usually start seeing some of these symptoms?
Right, about mid-60s and beyond is usually when many patients present with these symptoms or start to develop these symptoms.
And is there somewhere that we can go to have more information?
Yes, one can go, of course, to the Alzheimer's Association website for more information regarding this condition. That's really a very good resource to begin with.
Well, I'm happy we're having this conversation, because I know one of our viewers can definitely relate.
Yep. And how can viewers reach out to you personally if they're interested?
Yes, they can either go on to the neurology website on GBMC's webpage, where the number for the neurology clinic is there, and they can reach out to us, so we'll be happy to see them in our clinic.
Good to know. Thank you, doctor.
Thank you so much.
Yes, very good to be here.
Learned a lot.
I did too.